Hi, I'm Casey Harrell, and I am going to be performing my diabetic foot exam. My participant is not a diabetic, but for the sake of this, I will pretend that she is. First, I would start with evaluating with the patient with their shoes on. I would note if they had equal wear and tear on the bottoms of their shoes, noticing also if the shoes appeared to fit properly or not, whether it seems to be if they're too small or too loose. I would also note the type of shoe they're wearing. If they are diabetic, have problems with neuropathy, I would encourage them to not wear open-toed shoes for the sake that if they, were to stub their toe or foot or something on something, they may not be able to feel it, and it might lead to more serious complications down the road. So I would encourage them to wear closed-toed shoes. The next part, I would take off the shoes and I would just inspect the general foot just by looking at it. I would note several things. I would note the hair distribution pattern on the foot. I would note if there seems to be not a lot of hair growth. I would make note of that. I would think that might possibly lead to other complications indicative of peripheral artery disease, vascular disease, things like that. I would also, just looking at the nail beds, I would look to see if they're thin, if they're thickened in areas, if they seem to be, how they're groomed, if they're cut straight across, if they might have ingrown toenails anywhere, if they, I would check for, looking at the nail bed, I would try to calculate the capillary refill, noting if it's less than 2 seconds would be preferable. In this case, her toenails are painted, so I'd be unable to do that, but I would take this opportunity to educate the patient about pedicure places and how it's important to note that they will check for cleanliness there, and just that's an extra caution for them, just because if they do have neuropathy, they may not be able to feel if the water is too hot there, or if the if the beautician gets too close with her grooming. So that would just be an education point I would point out to them. I would also look for, like I said, ingrown toenails. I would look in between the toes for ulcers. I would look if there might be any kind of fungal infection going on at the nail beds or in between the toes. I would next just look and see, feel if there might be any edema anywhere, any at the ankle or radiating down, see if there's any edema, but there's none present. I would also palpate for warmth if it seems to be warm, if it seems to be cool. This would also be pointing out problems if they tended to be cool. I would think problems with circulation, that'd be something to look into further. When I palpate my pulses, both my posterior tibialis and my dorsalis pedis, I would normally like to do them at the same time bilaterally with both feet to ensure that they're equal. So in this case, I would just pretend like I have both feet, but I would just palpate, noting the strength, about +2 strong, good pulses in her feet. I would now check for the musculoskeletal part of the exam. I would ask her to push against my hand, checking for strength, and then I'd ask her to pull back as I push a little pressure. She's got good strength, 5 out of 5 in both. I would now move on to the monofilament testing part of my exam, explaining to the patient, that this won't hurt. It's just kind of like a poke. I would demonstrate it on another part of her body so she knows what is going on. I would explain to them to close their eyes. Then I'm going to poke a couple places on their foot, and for them to tell me if they feel it or not, and if they can describe the area in which I'm pressing the pressure. And this is testing for just the sensation in their feet, possibly evaluating neuropathy of the foot in diabetic patients. So if you go ahead and close your eyes, and I'm just going to randomly pick some places, and you just tell me if you feel it or not.
Yes.
And if you just tell me kind of where.
Middle toe.
Yeah. And then I just keep going.
Top of the foot. The middle of the foot. Outside of the foot.
Yeah. And so she was able to describe, the sensation of just that pinprick, so I would not need to treat her further for neuropathy in that sense. She does pass that test. Next point of doing the monofilament, like notice that not to do any places that might be calloused. I would avoid those, or any ulcers. That would be avoiding that as I did that. Next point of the test would be the testing with the tuning fork to test the sensation, the vibration sensation. So I would explain to her also that, you close your eyes for this. I'm going to make it vibrate and stick it on this bony prominence, and then she'll be able to feel the vibration, and I will stop it at some point, stop the vibration. She lets me know as soon as she's no longer feeling that, and I would want to check that her timing and my timing match up, that the sensation is both lost at the same time. Whereas, if she stops feeling the sensation, the vibration, earlier than I do, then there might be some kind of circulation problem going on there. So have you close your eyes, and I'm going to put it up against the prominence. Stop. Okay, so that she passed that test as well. Then just going back, and after I've done kind of everything on like the top of the foot and my 2 tests, I just want to also just kind of keep looking. I would want to look at the heels, just look at the back of the foot. Like I said, noting for ulcers, noting for calluses. She doesn't appear to have maybe a little callus on the edge of her foot there. And just noting, hydration of the foot, if it's dry, if it's cracked, just other kind of physical exams that I would note at this point. If I did suspect that the patient did have problems with possible developing neuropathy, or if they did have neuropathy, they were unable to, pass the monofilament and the tuning fork testing, then I would grade them accordingly. If they had, if it was like a low risk, I would not refer, like this patient, I would not refer her to seek, a podiatrist counsel or something like that. I would not refer her to them. I would, make it a note that just check on your yearly checkup when you go to the doctor, that they do a foot exam. If they were moderate risk, say they had some loss of sensation in an area in an area or two, or if there seems to be a deformity like hammer toe or clock foot, something like ingrown toenail, something, any kind of deformity, I would say that she might want to follow up with a specialist about every 3 to 6 months or so, just to have them keep a check on it, make sure that it doesn't get worse. If they were high risk, like if they were a known diabetic with a known history of amputation or ulcers, then I would definitely classify them as high risk, and I would want them to inspect their foot every day, noting changes in areas if it got worse, if it got better, but also to see a podiatrist or their primary care physician every 1 to 3 months, and keeping a check on that. So that's about the extent of my foot exam. Like I said, I would not refer this patient, so I would not recommend any emergent need of having to follow up, so I would just see her in another year. But that is the end of my diabetic foot exam. Thank you.